If you've ever lived or been to a major city, there's one part of the urban landscape that's hard to miss: homelessness. When was the last time, if ever, you stopped to talk, and I mean really talk, to a person living on the street? Dr. Stephen Hwang has spent his career doing just that. He runs a clinic at Seton House Men's Shelter and is also one of the world's leading researchers on homelessness at St. Michael's Hospital in downtown Toronto. Hwang sees firsthand the one aspect of urban life few people talk about.
My work has really focused on the connection between housing and one's social circumstances and health, and how we can help improve the health of some of the most disadvantaged and marginalized people in our society.
Raised in a middle-class home, Dr. Hwang admits he'd never been exposed to poverty or homelessness. But after volunteering at a homeless shelter in Boston, an encounter with a man and a mop taught him a valuable lesson.
This man came along and saw me trying to mop the floor in a rather ineffective way. And he took the mop from me and he showed me how to lay out a grid pattern and how to methodically mop each square of the grid. And then he handed the mop to me and he said, "There, son, now you can do it." And I guess that what really touched me and impressed me, and which I remember now, even 25 years later, is the fact that that this man, who was certainly in very difficult and dire circumstances himself with his wife, was still willing to take the time and the effort to help someone else.
Hwang says that although he'd noticed homeless people, he'd never really seen them.
That was really the first time that I met people who were homeless and got to know them not as some faceless abstraction on the street, but as real people that I got to know and spent time with. And I realized through that process that these were real people, each with a unique story, who sometimes through circumstances or chance or through unfortunate choices had ended up on the street.
Originally from the U.S., Hwang is a graduate of Johns Hopkins and Harvard University, and that's why he says his decision to work with the homeless was met with some disbelief.
I shared this desire with a professor at the medical school, and I distinctly remember him looking at me and saying, "That's a real shame, because that seems like a real waste of your talents to go and do that." So I remember being just taken aback by that very discouraging take on what I was doing. But at the same time, I think that it didn't set me aside from what I knew in my heart to be what God was calling me to do.
So what drives a doctor at the top of his class to choose working with the homeless over a glamorous medical career? Jesus.
It is helpful, I think, when I'm working with patients, to remember that their needs are not just physical ones, and that while medicine in general focuses on the physical needs of a person or on the mental needs, that there is a deeper need that all of my patients have and that all of us have, the need to know that they're loved and that they matter, and that they count. And I think that that's something that our faith teaches us and leads us to. It's not something that science leads us to.
And while today he's a world-renowned researcher, Hwang says his work with the homeless in Boston revealed the beauty and ugliness of his profession.
I would see people in a clinic at Boston City Hospital, and I would also go out and do outreach clinics at a shelter called Long Island Shelter, which is not Long Island in New York, but it's an island in the middle of Boston Harbor. The shelter, which was an old tuberculosis sanitarium on this island overlooking Boston, was one of the most beautiful places in the world. And yet at the same time, there was so much suffering and unhappiness and hurt among the people that were at the shelter.
Hwang and his Canadian wife, Dr. Angela Chung, moved to Toronto where Chung's family lives. He then took a job at St. Michael's Hospital researching inner-city health. And since he's been on the job, Hwang's research has traveled the world, helped shape policy, and laid the groundwork for new studies in the battle against homelessness.
So, for example, one of our studies looked at deaths among homeless people in Toronto, and this study found that homeless men were 8 times more likely to die than men in the general population. And in fact, young women who were on the street were 10 times more likely to die than people in the general population. And so that, I think, helps, those kinds of research findings help us to figure out what is the problem, that there's a huge amount of unmet healthcare need, of illness and death.
Another problem, he says, are misconceptions about the homeless.
I think that the first one is that people who are homeless choose to be that way, or that they actually would like being homeless. And I think that almost all people who are homeless would rather have a home. A second, perhaps semi-myth, is the idea that all people who are homeless have mental illness. And I think that it's true that some proportion of people who are homeless do have a serious mental illness, that they don't account for, that doesn't account or explain homelessness entirely. The third thing that I think is, again, understandable, but I think perhaps a stereotype, is the idea that people who are homeless have made bad decisions in their life, and that's why they've ended up homeless.
According to Hwang, it's time to examine homelessness in a more nuanced way.
Much of who we are and where we end up in life is affected not by our choices, but by our family and our parents, where we were born, the society that we grow up in, the communities and neighborhoods that we're in, the absence or presence of loving people in our lives that guide us in the right direction. In a way, I think it's a very Christian principle that we are where we are not by our works, not because we are good people and we've done the right thing and worked our way to where we are, that our understanding is that we are where we are by God's grace.
Another issue, says Hwang, is that many people don't understand how difficult it is to focus on life's daily tasks without a home.
That means that it's hard to make appointments, it's hard to keep appointments, it's sometimes difficult to prioritize your health care when other issues such as where you're going to sleep or what you're going to eat tonight are on your mind. The fact that if you call an employer and ask about a job and you have no phone number, no address where they can reach you, that's going to be a huge barrier. The environment that one lives in, if one's in a shelter or on the street, is really the opposite of what one needs to be healthy. It's a very stressful, often chaotic environment. There's a lot of drugs. There's a lot of, I guess, verbal abuse. There's a risk of having one's possessions stolen.
As a scientist and a Christian, Hwang says he wrestles to combine his faith and his work every day.
Each day I seek the Lord's guidance about what do I do today? How do I make choices for each patient, or how do I speak to a patient in a way that is wise and loving and I guess reflects my walk with God and I guess an effort to live that out. It helps me to remember that we're all equal before God and that I should treat each person the way that God has loved us.
Hwang is currently working on a study that takes a new approach to housing the homeless.
And what we're doing is we have funding for rent supplements or rent subsidies that allow us to help people move directly from the street into subsidized housing and provide them with case management or other supportive mental health services that help them stay in their housing. So what we're saying is, rather than asking people to get healthy so that they can get a home, we're saying, why don't we give you a home and that will help you to become healthier.
And as he uses his practice to help the homeless get healthy, he also strives to make his relationship with Christ tangible to those who often have both physical and spiritual wounds, he says.
Whether it's a patient or whether it's with my family or whether it's with a colleague, my work has helped me to think about and understand how do I make real my faith in my daily work. It's one thing to have faith or to believe or to know the gospel. It's another thing to work it out in our day-to-day lives, and that's what my work has given me the wonderful opportunity to do.
And while we can't all offer medicine like Dr. Hwang, this new year try volunteering your time at your local homeless shelter. To find out how you can help the homeless in your community, visit 100huntley.com. In Toronto, Ontario, I'm Bridget Antwi for 100 Huntley Street.